Okay, so we're going to talk about Achilles tendon pain, and I say Achilles tendon pain because it comes in so many shapes and forms. So we have obviously Achilles tendonitis, and then we obviously have tendinopathy. So there's a lot of, I suppose, confusion about those particular types of conditions. So let's start with, say, an Achilles tendonitis, which is basically the start of an Achilles tendinopathy, but it's through the reactive phase. Okay, so it's very, very treatable at that stage if you get it early enough, and we can make a lot of changes. And obviously Mon had gone through this on the post of a hamstring injury that she had and developed this left Achilles tendon pain. So part of the problem is that at that reactive phase, you're actually not quite sure how bad it is. And you're saying, just got sore Achilles. So sometimes it can just sneak into that tendinopathy, and that's obviously when it becomes completely different because the morphology obviously of the tendon changes. So, and then it becomes more of a chronic overuse injury of the tendon, and that can be really particularly temperamental to deal with. You know, it's one step forward, two steps back, and two steps forward, one step back. So one of the things you can do as a hands-on therapist is obviously control a lot of the load that goes from the muscles to the tendon. But keep in mind, the actual Achilles tendon needs load. Okay, that's part of the therapeutic approach to dealing with Achilles tendon pain. So part of the problem with that is obviously it's too much load, obviously can create issues. So from our point of view of hands-on therapists, we want to try and play a role in sort of offloading that load that goes to the tendon, okay? And so we want to keep it within that realm of being therapeutic changes. Okay, so there is no doubt that your athletes, if they've got an Achilles tendon issue, then they should be doing the proper strength and conditioning for it. So there is significant exercises dedicated to that. So it is really important that they're doing that. For us, from a hands-on point of view, straight away what we're going to be looking at is this gastro muscle. Okay, so that's our big explosive muscle, especially for Mon, who's a 400 and a 200 meter runner, and then we have our soleus. Okay, now we do have, I'll show you on this side here, we do have a trigger point that develops in the medial soleus. Now that mimics Achilles tendon pain just beautifully. Okay, so that's an area that we'd want to probably look at. What you'll also want to do if you're dealing with Achilles tendon pain, to make sure that you're not dealing with something that can mimic it, and that is obviously putting your Achilles on stretch and then giving it a squeeze. Okay, now if it's true Achilles pain, that'll bloody hurt, okay, and it'll be very sensitive. So that's a fair start. What also you tend to see is a thickening of the tendon itself as well. So those two things are really important at that reactive phase, so that you're keeping an eye on it. If you're in doubt, then make sure that you send them off to get an ultrasound done on that to confirm what's happening with that Achilles. So it's very, very important. Okay, so part of what I've talked about with medial shin pain is that the medial compartment, tibialis posterior, is really important in terms of dealing with not only medial compartment issues, but definitely when we start talking about Achilles tendon pain, because simple fact of the reason is that tibialis posterior controls a lot of the foot placement when we heel striking out. Okay, so if it's loaded and it's not doing its job, it's inhibited, or for whatever reasons there may be something else going on underlying it, then it can and it will allow a little bit of that overpronation, okay, which is not ideal because you get a whipping action to that Achilles, okay, so that can also start up issues with it. Okay, so let's look at the technique that we're going to do for Achilles tendon. As I said before, the soleus can mimic Achilles tendon pain beautifully, okay, but keep in mind when we're working with the gastro and the soleus, we need to be focusing on both of those. So we have a couple of trigger points up high, both in the lateral and in the medial compartments here as well. So we can focus on those. Okay, so what I like to do, obviously once again, we're going to use the fingers with a hand over the top braced and work across the actual muscle itself. Okay, so it's really important that we're dedicating as much pressure within what our clients can handle across the lateral head, okay? Then we can come across the medial head as well, okay? Now, some of the things that I like to do is get the broad forearm involved. So I will just turn the leg slightly in, and then I can pick up with a really broad forearm, okay? So now I can sink down into that area and work really purposeful and slow, okay? So this is the side, I suppose this is the speed that we like to work at with this particular type of technique, okay? So if you're rushing through here, then you're really not doing your due diligence and picking up a lot of this tone, okay, and deloading. So we're going to work it all the way up, okay, and then we blend off, and again, sinking in, going to drag the tissue over, lock down on it, and then work through. Okay, now what we also can do is we can stop for each one of those trigger points too and just sit on those, just looking at, watching them deactivate, then moving on to the next one and working through. Okay, so don't rush this technique, okay? It's really important that it's purposeful, because a lot of therapists just love to just smash, work through really fast in this tissue, and trust me, that's not the result you're going to get, okay? So you take the exact same approach to working the medial compartment as well. Okay, so we come down to the soleus, which is our middle distance muscle, as we all know. So that's the workhorse. That one takes a lot of the load. This is our explosive sprinting muscle, gastro, so it's important that we dedicate significant amount of time once again to this soleus. So as I said before, what we can do, address lateral and medial. Keep in mind that we have that trigger point in the medial, which mimics Achilles tendon pain just beautifully, okay? So it's the same approach again, but now what you're doing is you're applying it to your soleus muscle, okay? Or soleus, depending on how you pronounce it, okay? So once again, locking down, purposeful pressure. Do not try and rush through it, okay? So it's all about working purposeful, okay? Really important. Now, do not get sucked into working on the Achilles itself, the tendon itself, because more than likely what you tend to do is aggravate it, okay? So a lot of these techniques are dedicated just to offloading that tendon through there, okay? Once again, you need to explore this trigger point in the medial head, okay, because basically it refers right into the tendon and sometimes down into the heel. Sometimes your tib post can also refer down into the Achilles as well. So they are two trigger points that you can dedicate time to see if they could possibly be a mimicker. Okay, so let's look at this Gastrocelia Stretch here now. So once again, this shouldn't be rocket science here, but once again, it's all about the foot placement and whereabout you are. So we're looking at obviously stretching this entire area here. Obviously, we're looking specifically at the gastro as well. This is a stretch you want to hold for about 15-30 seconds if you like. Once again, it needs to be comfortable. You can also, if you want to, if you move your foot a little bit out that way, then you can pick up a little bit more of the medial compartment, and if you bring in towards you, then you hit that lateral compartment, okay? So you can explore all those areas with this, definitely this gastro stretch. Obviously, there's a certain amount of flexion through here, so that will depend on how much flexibility your clients have got or your athletes have got. In terms of stretching the soleus, we've now got a separate stretch for that and a separate setup, and we'll show you that now. Okay, so the soleus stretch, obviously we'll look towards this front foot here. So what you're basically going to do is bringing the knee in towards the wall this time, okay? So what that does is tends to isolate a little bit more on this lower part of the soleus as well. If you want to add an increase in this stretch, then what you'll do is you'll bring the foot, put it up against the wall, simply like that, so the toes will rest up, and then obviously bringing the knee in towards. Once again, you're going to hit that soleus a little bit more specifically. Once again, 15-30 seconds should be more than enough.